Hey everybody, good afternoon. We are so excited that you are here, thrilled that you are part of our PCA and HCCN professional development series. We're kicking things off today and just really glad that you're with us. I'm Suzanne Spear, and I'm the Director of Workforce Development here at ACU. And I think for most of you, I'm a familiar face. And so there's my Bitmoji. You see me, I've got my webcam on today, so you can actually see what I'm doing. And I hope that'll make it a little more interactive for you guys. We've got some poll questions and things today. I'm just really looking forward to seeing you, hearing you, and really just getting to know what you guys are all doing. And we've got some questions and some ways to interact with you as we go forward. So for those of you who this is your first introduction to ACU and you've never heard of us before, we are excited that you're here. So the Association of Clinicians for the Underserved is a national nonprofit focused on the recruitment and retention of clinicians in underserved areas. We were founded over 20 years ago as a National Health Service Corps alumni organization, and we have changed a lot over the years and done a lot of different things, but really at the heart of what we do, we are workforce people. And again, we've got that National Health Service Corps background. We have programs that produce resources and training materials. We also have an annual conference every year that provides networking opportunities. And bottom line is we just are all things clinicians in underserved areas. So we have a separate website. We have a website that's not on our slides today, and that is clinicians.org. And so if you haven't visited that website, go check us out. So as I mentioned, we have several different programs, and this webinar is being brought to you today by our program, which is the STAR Center. It is funded by the Bureau of Primary Healthcare, and it's related to everything clinician recruitment and retention. And if you're not familiar with the STAR Center, it stands for Solutions, Training, and Resources for Recruitment and Retention. And again, if you haven't been to our website, or if it's been a while and you haven't been there anytime recently, we would encourage you to go and check out all of our resources there. And that is chcworkforce.org. And when we're talking about the STAR Center, I would love to just let you know who our ACU faculty is. So obviously, I'm Suzanne. I'm the Director of Workforce Development, but I'm excited to have our two other ACU staff, our other STAR Center staff, on the line with us, and they're going to pop on their webcams in a minute and introduce themselves to you. So first, we have Mariah Blake, and she is our Program Manager.
Hi, everybody. I'm Mariah Blake. You've probably gotten an email from me before, and I hope you will email me if you have any trouble with your connection, any questions about what we're covering in this series. I put my email in the chat there, and I'm happy to get in touch.
Yeah, wonderful.
Hey,
Mariah, keep yourself straight.
Thank you, Mariah. Hey, everyone. I'm Sabrina Edgington. I'm the Director of Learning and Curriculum Design at ACU. I'm the newbie, so I've only been at ACU for about 3 months, but looking at the list of participants, I am familiar with a lot of you from my work at Integrated Work, as well as the National Healthcare for the Homeless Council, so really excited to be working with you through this work in partnership for ACU. Thanks.
Yes, thank you, Mariah and Sabrina. We're thrilled to have them on this call. And I did want to mention that they're not listed here on our slides, but throughout this series, this is the first of a 6-part series, and we're going to be having some faculty from other national cooperative agreements joining us. So we have APJO, which is I'm not going to botch it, and so I just want to, anyway, APJO. We also have CHC Incorporated, as well as as well as NAC with us as guest faculty throughout the series, but just ACU today. So just wanted to let you guys know the goals of the series. So really, first and foremost, as PCA and HCCN staff, we want to help to build your workforce expertise. There are a lot of professional development opportunities for other types of folks that work at PCAs and HCCNs, but not a whole lot of professional development for workforce staff. So we really wanted to provide an opportunity and a space for you guys to really build your knowledge in this, for this, you know, in this arena. We also want to hear from you guys and really hear the things that you guys are doing at your PCAs and HCCNs and how you are building successful workforce programs, all of the different things that go into that. And as we go through this series, we are going to not only have guest faculty from other NCAs, but we're also going to periodically hear from other PCAs and HCCNs in various topics. So stay tuned for that. And lastly, we just wanted to give you guys an opportunity to connect with others and hear what they're doing again through their sharing things, and also from the chat, from when we ask some poll questions, and then periodically we'll open it for questions at the end, but periodically we'll give you guys a chance to really weigh in on things that are going on as relates to topics. So excited to bring this all together and really just to get started. So a few housekeeping items. We are recording this webinar, and we will be sending out not only the slides, but also the recording of the webinar after this session. And so stay tuned for that. We want you guys to ask questions. We welcome questions. Again, we'll have some opportunities for you guys to weigh in on polls, and also some times where we're going to use some questions in the chat, but we welcome the questions. We have a question and answer box as well as a chat box. So feel free to put things in either place, and Mariah and Sabrina and I will be monitoring those as we go along. We also are going to be having a session evaluation at the very end. So stay tuned for that, and please go ahead and fill that out. It really helps us with the feedback to get the best possible presentations and the best possible topics for you guys. And besides that, we want you guys to have fun. We really are here for you guys and really excited for you to be a part of this today. So again, feel free to put your questions in the chat or questions box, and email Mariah at mblake@clinicians.org if you have any questions, connection issues, any of that kind of good stuff. She's your girl. Okay, so objectives for today. We have a packed agenda. So first of all, we are going to be understanding the importance of having a TTA plan when it comes to retention. So I know that you guys are after the NOFO, and everything's been submitted, and you're thinking about as you're in this next sort of 6 months, maybe 5.5 now. Oh gosh, only 5 now, but this is the end of January. You're going to be thinking about really how are we going to be doing that recruitment and retention plan. So we're going to be talking about really the importance of that. You guys already know, but we're going to be talking about it here today. We're going to be identifying the building blocks of a staff retention plan, and we're also going to be identifying some tools and resources to help you guys build a written retention plan, and also for you to be able to share things with your health centers that you serve. Okay, I mentioned poll questions. This is our first one. And so we want to know what type of organization that you are representing. So if you're a PCA, are you an HCCN? Are you a National Training and Technical Assistance Partner, or an NCA? We're kind of using them a little bit interchangeably as before the funding cycle ends, or other. And if you're from other, we would love to hear from you if you want to share what type of organization you are in the chat box. So we'll leave that open for about another 10 seconds, and then we will close it, and we'll be able to see the results. All righty. Wonderful. Okay, so the majority of you guys are from PCAs. We have 2 health center controlled networks, and we also have 4 folks who are joining us from other organizations. We have an AHEC joining us. So anyway, thanks again for joining us, and I'm really excited that you are joining us today. Okay, now we have a question before we dive into the content. So I just want to check and see with you guys, what is the biggest thing, or maybe just one thing you want to take away from this series? So I know that you have probably seen the different topics that we're going to be covering during this series, but we would love, if you have a second, to put it in the chat box what you would like to hear from during the series. So some best practices, some workforce development plan best practices. Absolutely wonderful. We will do that. And as I mentioned, we're going to be having some experts from NCAs or NSAPs, and as well as PCAs to share some of those and really how they're implementing these things. A workforce plan or a workflow, I like that. Provider wellness and also burnout prevention. Huge, huge thing that is this really this buzz topic, this buzzword, and we're definitely going to be talking about that throughout this series. Tools, templates, and approaches, and also how to measure staff turnover and retention. So thank you guys all for weighing in. Feel free to keep going. I'm going to keep moving with that. At the end, I know we probably have a couple questions. You guys can monitor. Jamie just put in a question about, anyway, she just put a question in there. So if you guys are going to want to respond to her, that's a question that looks like for everybody. So I will bring that up at the end if we have time for, time to dive into it. And if not, feel free to respond to her in the chat. So anyway, thanks for you guys for responding and also your feedback as far as what you'd like to get out of the series. Okay, so we're going to dive in. We are going to look today at the building blocks of a staff retention plan. I want to ask you another question, and feel free to use the chat box to respond again. So what should PCAs, HCCNs, IHECs, anybody else that's on the call, really, why should we care about staff retention or building a staff retention plan? In other words, why is turnover not a good thing? We know that turnover is inevitable, and we also know that people are not going to stay with us forever. But when we talk about this, and this question is really aimed at the fact that what happens when your turnover reaches levels that you're just struggling to keep up with? You can't keep things together. So why is that bad? As you guys put things in the chat, I just put some ideas down, jotted some ideas. There a lot of different reasons why high turnover isn't good, but first and foremost, it reduces employee morale. It also increases burnout, because if your staff is turning over all the time, and so say if you're MA staff, you're having trouble with your MA staff or your other support staff, and your providers can't have a consistent support staff to really help them with their patient panel, then that is really going to stress them out and, and have an adverse effect on them. It's going to affect productivity, and it's also going to impact your patient experience. So if you have high turnover and folks are coming in and they don't see the same person every single time, not necessarily their providers, but the people at the front desk, the friendly faces that greet them every time that they walk in, the person that's taking their blood pressure, all of these different types of things. It's really, it's definitely going to affect that. And finally, it's also expensive. So when we're talking about the expense of turnover, I wanted to let you guys know that we have a tool. It's called the Financial Assessment Tool, and it is going to give you the total cost of turnover, which includes the separation, vacancy, recruitment, and also onboarding costs. And I'm going to ask Mariah if she wouldn't mind just putting the link in the chat when she has a second. And if you're not familiar with it, this is a great place to start for your organization as well as your health centers. Sometimes if we take a look at other factors, and we're going to talk about this in just a minute, so increasing salaries or benefits or that kind of thing, and you're looking at the total cost of that, this is a great thing to take to your health center CEO and say, okay, I know you're struggling with paying people XYZ or giving them raises or what have you, or benefits, those type of things, but look at what the cost of losing one provider is going to cost us, right? So it helps to, in black and white, get a tangible look at what they're doing and really that black and white comparison. So just wanted to mention this at the beginning, as it really is a great tool to put those numbers in black and white and show the value of our retention program and a true written retention plan. So thank you for putting the assessment tool in the chat. Okay, so staff retention plans. When I think about when people talk, generally speaking, about recruitment and retention plans or staff retention plan, there are so many things that could go into it, right? I don't know if you guys remember having Legos or if you have children, if you have Legos, but golly gee, there's so many parts and pieces and they can be built in so many different ways. But when, if you get a new set of Legos, they come with a step-by-step booklet that really that shows you how to put it together. And so at the end, when you get to the last page, you've got this final product. And so this is what a staff retention plan is. There are a lot of different ways to build things, but it's great to have a plan and a written plan at that. So when we talk about retention plans, I want you to think about really taking it from something that's abstract and that's just a bunch of Legos in a bag or a box or what have you, to something that you can be a finished product, that it can be a whatever it is, the final product. Heck, you can even build Star Wars, the Millennium Falcon with one, or something with Harry Potter. Anyway, so many different possibilities. And so I want you to know that what we talk about today is they're just some of the things, right? And some of the big topics, realizing that there are a lot of other things that you can put into a staff retention plan. But we just want to cover really the big things today and those big buckets of things that you can put in all these different things, and you can really provide a detailed, as much detail as possible, really. But when thinking about retention plans, those building blocks and those big structures of a retention plan are mission, compensation benefits, they kind of go together, work schedules, and a career path. Again, there are a lot of other things that we can talk about and we can talk about separately if you have questions offline about, but these are really the building blocks and the foundations of a retention plan. Again, lots of other things we can do, but for purposes of today, we're going to stick with these 5 things. So mission. I know working with underserved populations and at nonprofits, we're always thinking about mission, right? It's like it probably in your mission statement, right? Anywhere that you have printed materials, mission is always involved. And so think about this when you're doing your retention planning. It should be weaved in throughout all of these different things, right? Your recruitment process. We won't talk too much about the recruitment process because we're going to talk about that in a later session, but your onboarding process as well as your overall engagement of your health center staff. So with recruitment, really you want to weave the mission of your organization into the recruitment process. You want to think about, how do you source your health center staff? Do you just are you just going to advertise on for-profit publications, or do you want to have something and focus on something such as like the NHSC job board or other things that really get more to underserved populations? Not necessarily something that, there's not one size fits all, and you really should diversify, and that's a topic for a whole nother day. But just think about that when you're really weaving that mission and folks that have that mission heart. You're really trying to target them. You also want to, during your entire interview process, and yes, recruitment and retention are linked, so you want to make sure that mission is, you're thinking about that during the interview process, what questions you're asking and all that kind of good stuff. So keep that in mind during your recruitment process, and as you're really trying to find those people that are going to be a great fit for your organization, that are probably ultimately going to stay, hopefully going to stay at your organization. Okay, so you also want to weave mission into your onboarding process. Again, this is very much linked to your recruitment process, but you want to make sure that they have people who are, or you just want to make sure that you're weaving the mission of the organization and all of that that goes along with that and serving underserved populations into your onboarding process. So really having those mentorships, those connections with people who are really, who have been at your organization for a long time, they understand the mission of your organization, what you're there to do, how you're there to really improve the populations of folks you serve. Just keep that in mind as you are doing your onboarding process throughout the first, 3 to 6 months at your organization with a new employee, because what you do during the recruitment and onboarding process is really going to affect that retention. Also, too, you want to make sure that you weave your mission in your engagement with that health center employee or provider. So you want to make sure that you connect them with volunteer opportunities, connect them in the community, as also give them a chance to, if sabbaticals are important to the people that you're hiring because they want to do mission work. I know when I was a recruiter for the Virginia PCA, I talked to several providers that doing mission work was really important to them. And so whether it was a 2-week or a 2-month sabbatical, obviously every health center is different. And so when we think about this and when you're sharing this with your health centers, something to think about, right? It's not possible for everyone, especially if you're a really small health center or if you have a location that's a very small and only 1 or 2 providers. Sabbaticals can get tricky, but think about engaging them, engaging the missional aspect of them and who they are and what makes them tick. Think about that as you really start to engage your staff, because ultimately it's going to lead to retention. So that's what we talk about recruitment when it comes to retention. The next block or the next rung that we're going to go down is we're going to talk about compensation. And this is probably, and I don't know if you guys think about it first and foremost, but I know I do when I think about retention and what can we do to increase our retention. Salary always comes up, right? So you want to think about your whole compensation strategy. It's not just about that final number, and we're going to dive into that right here. So when it comes to your overall compensation, you want to think about that work-life balance. That's huge. And I know a lot of times, whether it be someone who is right out of medical school or residency rather, or dental school, work-life balance is important to them. Work-life balance is important to people who might be in that sandwich generation. So they're trying to take care of, people at home, whether it be parents or grandparents or their own children. And it's also important to people who might be nearing retirement. I also talk to a lot of folks that really they want to slow down their career. They didn't want that overhead cost. That overhead, the burden of the overhead, but they still wanted to practice because they really loved practicing their craft, and so they wanted to be involved in medicine. So all that is to say is that no matter what generation you're dealing with, there are 5 generations in the workforce these days, y'all. Think about how you can weave work-life balance into it as a part of your retention plan. I promise you won't regret it, and the folks that you're talking to about this won't regret it either. Again, whether it's doing 410s or having limited call or all of the type of things that you can offer when it comes to work-life balance, think about it. You really won't regret it. Also, too, we mentioned here childcare. This is one that you're like, Suzanne, we're not running a daycare agency. We're doing healthcare. So some health centers, they are able to provide a childcare benefit. So they give a stipend to their providers or their staff for childcare. They have a relationship with somebody in the community and they give discounts or a stipend or things like that. So think about what makes people happy outside of coming to work every day, and think about how you might, or the organizations might weave those benefits in to really making their life more pleasant to come to work by making their home life better. So again, it's part of compensation because that's the total package, right? So work-life balance is the first one when we think about compensation. Second, when we think about compensation, it's all the different types of financial assistance that you could help your providers and your other staff with. So a lot of these that are here, financial planning, mortgage assistance, and also transportation. These are things that a health center, an organization, is not necessarily going to do themselves, right? So they're probably not going to provide mortgage assistance to somebody that is just moving to their community. But these are things that you can connect them with. And if someone comes in to your health center and you're onboarding them and things like that, but you have all these different resources for them to take advantage of, they're going to think, hey, these people care about me and they want me to succeed, even though it's just a recommendation or a partner that you have, or just a website. Well, no matter what your level of involvement with these things, again, whether it's just a referral or somebody that you have a relationship with that that you're working with to help folks do these things, having these things available and having them be something that you show them you're thinking about is really going to go a long way to having people be retained at a health center or any organization for that matter. Hey, they care about me. They want me to, oh my gosh, this new provider mortgage assistance program, because they're actually, there is. I went to a job fair once, and there was a mortgage company there, and I was kind of scratching my head, like, what do they have to offer? Sure enough, they have something that is a new provider, a mortgage assistance program. So anyway, think about how you can include these type of referrals, benefits when it comes to your total compensation program. Also, think about other ways that you could compensate your providers and other staff. So do you have an employee assistance program that you could, again, it's kind of a referral thing. It's not something that your HR department does, but you have a referral system that you say, hey, if you need help with X, Y, or Z, go here, and they can assist you with that. Discounts. This can be anything from a local museum to if you are at a near a state park and that's recreation's really big in your area, giving a year's, or state parks are free, but if there's anywhere else that if there's an amusement park or things like that, something that is really popular in your area, think about looking into discounts for that. And then finally, vacation, to do all these fun things that you're thinking about. So vacation kind of goes along with work-life balance, but it also goes along with recreation too. So think about that and how you can help your health centers think outside the box. And if there are best practices that you're hearing, and making sure that you're sharing those with others. These are really, this recreation piece is really big regionally. If when we go and talk to people in Alaska, it is very different. Obviously, their recreation is very different than say in like Florida or Texas. So think about that and how folks might build up their compensation programs to really to add to what they're doing on their side of retention. Okay, something else when we think about retention is career path. This is a really big one. Another huge thing that I saw and heard when I was doing recruiting in Virginia. So really think about this as a career path. What opportunities does somebody have after they're employed by you? If they start out at your front desk, do you have, is there a way for them to do other things, whether it's to go into sort of the medical side and be an MA or, an LPN or something like that, or, do they want to go into billing and all of that kind of stuff? So really, what opportunities do you have, not only with your provider staff, but also your non-provider staff, your support staff? What kinds of things can they do once they're employed by you? So some of the things we're going to explore right now are training, special projects, and also financial support for their career paths. Folks are, a lot of times when it comes to, especially if you're talking about medical training, this may or may not be something that that you do in-house, but CMEs and all of that kind of good stuff. A lot of folks are do that outside of your organization. But when we talk about any really other types of training, you want to make sure that you are providing counseling or just advice. And here are your options as far as training opportunities, whether it is an Excel course or something that has to do with your EMR. Any type of training that you can provide, make sure that your HR staff knows about it and that they're advertising it. So really that counseling piece. If it's something that is relevant to a lot of your organizations, really see if you can do it on site. Is it more cost effective to bring people on site and do that training versus sending folks out to do it? It's probably going to take less time in their day. If it's a half-day training, then they can work a half day and then do that. Heck, it can even be at lunch, right? So to see if it's more cost effective to bring it on site, and then also make your trainings be relevant, right? So nobody wants to sit through a training that isn't going to positively affect how they're doing their job every day. And if it's something that is they have to be trained on and it doesn't seem necessarily exciting, really help people understand why you're training them on it and why it's important as a part of their job, and it could possibly enhance their job. So training is the first thing when we come to career path. Also some special projects. So a lot of times providers come to health centers because they love to teach. Maybe there are other professions that are like this, but I know a lot of times providers, they love to teach. I don't know what it is about this specific career, and not everybody does, but some people do. So are you giving them an opportunity to teach, whether it is through precepting at your health center and bringing folks in, whether it's they want to teach at the local community college or things like that. So see if there's opportunities for teaching, networking opportunities. Are you allowing them to network with other medical professionals or other folks, that are MAs? Think about that networking opportunity and to really connect them with other people that are doing those things as well. And then also think about research, giving them opportunities to do research. This is another thing that some folks like to do. And so if you're going to give them an opportunity to fill their buckets and do things they like to do, then they're really going to stay. So think about that when it comes to career paths, special projects, all those type of things. Think about it as an investment in the people that are on staff, and to really help them to fulfill their professional buckets to really enhance the things that they are doing every day and serving the populations, serving the people that they serve every day. Another thing when it comes to career path, so what type of financial support are you providing folks? So this is another big one. And when it comes to that turnover tool, this is a big one that we get, because if you're looking to see how you can support training and career path and all that kind of good stuff, what financial sense does it make, right? How much are you going to be able to cover tuition? A lot of times, or I've heard, maybe not a lot of times, but I've heard some health centers that are going, if someone is interested in being an MA, a medical assistant, but they don't really, that they're starting from ground zero, they come in as a front desk person, that, they cover the tuition for them to go to MA school as long as they stay for a certain period of time. So think about the return on investment in that tuition. What types of positions that would be good to cover that tuition, and the type of programs that might be good for. Also think about how you can provide financial support. There are a lot of organizations and associations that providers are going to want to be a part of. A lot of health centers cover not only CME, so time for them to maintain their time and money to maintain their licensure, but also to be a part of associations, because again, that networking is really important to them, because they want to be able to really liaise with the folks that are doing the same things as they are, So giving them an opportunity to be a part of this association is really going to pay dividends. And even though it might cost the organization more on the front end, it's really going to pay off for people feeling fulfilled in their role. Also, 2 other resources. Are there publications that they want to subscribe to? Is there something, whether it's online or print, that might enhance their overall working life? So just think about it. Again, when you're talking to your health centers, help them to think outside the box. If you hear a great best practice or something that is really working for somebody, again, jot it down and disseminate it at, when you're talking to other people at your next training. So think about how they can do that. Again, it's always wonderful to hear what people are doing and how they're incorporating things into what they're doing at their health centers. Okay, so we have gone through that super fast, and I know I really gave you a lot, but I want you to know that a lot of what I just went over, the highlights, are in our recruitment and retention plan. So all of those 5 different rungs are in our recruitment and retention plan. And if you download that resource, you will notice, if you haven't looked at it before, you will notice that retention comes first. And that is not by accident, people. That is something that was done very intentionally. So you'll find that there. You'll also find some instructions and also an action plan. So all of those resources are there. Mariah's dropped it in the chat. Thank you very much, Mariah. And I think you'll find that as we go along and as we go through this series, at the end of our time together, during the series, that you'll really have an idea about how all these building blocks that we're talking about, because we're focusing on retention here, but how they all play together and how all those things are important, and how that plan, that you can take all of these different things that are talked about during the series and really start building a retention plan, building a recruitment and retention plan, obviously focusing on retention, and then also sharing that with the folks that you are working with. And we hope you'll find that valuable. Also, too, as you go along and we go along through this series, if you have questions about that, absolutely feel free to contact us. We're more than happy to walk you through it, any specific questions, during the series. So today we have talked about identifying the cost of turnover at an organization, which really gives you an idea of how important your retention planning is. And because I'm telling you, whether you use the nationally available data or you plug in numbers by yourself, turnover is really expensive. Now we're talking about providers here. Our turnover tool focuses on providers, but you can really understand how it relates to other staff too. We have identified the items involved in a retention plan. Again, there are other things too, but the main 5 building blocks. And then, having you guys really start on writing your plan down. And that's another big thing I will say about all this, you guys, is that writing this down is key. I know that health centers are required to have a recruitment plan, but there aren't a whole lot of, they're required to have a written recruitment plan, but there aren't a lot of, there's nothing that says it has to be, X amount length and this has to be included. So writing all these things down and being as robust as possible is super important. You're also going to want to revisit it as often as possible. So if you're talking with the health center and you're chatting about their workforce efforts and they say, well, yeah, excuse me, I've got a recruitment plan. Oh, okay. What does it look like? And when was the last time you updated it? So all those are really important questions to ask. And, this is something that as we go on through the series, I really want to impart on you that all of these are moving parts, right? So one thing might affect another. So if you change one thing, you want to change another. So have that really stress with the folks that you're working with, that this is something that you want to take a look at all the time. And also too, as priorities change from an organizational standpoint or from your staffing standpoint, you might need to change these things to make it more relevant. So just think about that as we go along. So we've got a question that just came in, and so the question is, does a template, instruction, or action guide include tools such as how to talk to finance about the plan and why it's important? It's got a little bit of, the instructions version has some reasoning behind why we do or why the things are in there. So I would encourage you to look at the instructions template. That's the one that when I look at, when we're looking at things most often, and before I was actually on board an ACU, the instruction version is a lot longer than the blank version. These things are in Word, so you can take them and change them as you go along. But yeah, it might not lay out step by step why, how to do things, but it gives reasoning behind why we're looking at things, and that might help you guide the conversation. If there are things that aren't necessarily covered in there, but you still have questions about, feel free to reach out to us, and we're more than happy to help you with that and get you those answers to those questions. If something comes up that we think as TTA providers that, we think, it comes up multiple times, then we'll think about doing another session on those things in the future. But yes, it definitely gives you some reasoning and some sort of reasoning behind why things are there and why it's important. Okay, so speaking of questions, who has questions? We definitely have some great time. We've got a few other things to talk about moving forward, but I wanted to know, what questions do you guys have? I know that a lot of this you might have seen before. You may not have seen before. Is there anything that you want to know about either our template, the building blocks, or maybe some other things that weren't included? Again, some other things, that we didn't really talk about today are communication, those type of things. There are a lot of other things that you can involve, but thinking about, any other questions that you might have. Okay, so we also had somebody that shared with us in the chat box that they're interested in focused content on making a business case for having an R&R plan. So finance is on board and thinks of a recruitment when budgeting. Again, that financial impact tool is going to be really, really important. We are coming out with we're coming out with a turnover tool to capture that, so we can have some nationally available data. But the financial impact tool is really going to help show them the measure and how much turnover might cost them. So, and also we're going to talk about data later on in the series, but having that data to really show either what your turnover rates are, how much it's costing you, all that kind of good stuff, all of that I would say maybe might help your business case. But that is really a great thing to bring up, is that so many times our C-suite, especially our CFOs and the like, they really are like, well, what's this going to do for us, right? How is it going to impact our bottom line? How is it going to help us see other patients, et cetera, et cetera. So, so that the financial impact tool is really going to help you to show the cost of turnover. And, again, it's just on a provider basis, but it can be, representative of how much turnover is costing them, and also how you're able to really show the pros and cons, right? Put it in black and white, right? Well, if turnover is costing us, $100,000 a provider, and the providers in our recruitment and retention plan that we are going to have incentives or additional time off or any of those type of things, you can really weigh the two different costs and really see that in black and white. And I think that is so important. I completely agree with making that business case. That's a great way to put it there. So thank you for that question. Any other questions that you have about this or anything else on the series that you think about or want to know about? Okay, while you're thinking about questions, I'm going to go ahead and move to this next slide. So moving forward, so again, we're kicking off our series today. This is super exciting for us. So first of all, I know a lot of you were on the workforce development peer learning team meeting yesterday, and I know there's going to be a face-to-face for that, but we mentioned this to you guys during our PCA calls, but we are also planning on having a face-to-face. We are working out the details as far as location and all that kind of good stuff, but it's going to be the week of May 18th. So information is coming very soon. I hope that we can send out information before our next monthly webinar. So look for some information on that. Again, send us your questions and needs. In a minute, I'm going to show you a slide that has all of our emails on it. Reach out to us at any time about anything. Additionally, IWS has a cool new platform, and I want you guys to connect on that. That's part of that with that peer learning and really having that that resource there. So we decided to really focus that instead of giving you guys another login to another discussion board, to really enable you guys to use that platform and to ask questions about best practices or things like that there. And we hope you'll take advantage of that. So in our last couple minutes together, we are going to really preview an assignment that's coming your way on a workforce TTA assessment. So again, this is something else that we had talked about previously, and I wanted to preview it here. So this workforce TTA self-assessment tool is something that we hope you guys will find very valuable when you're designing your TTA program. So their workforce is this huge bubble, right? If you think about it as, as this umbrella, and that it encompasses all these different things, we are hoping that the self-assessment tool is going to help you target your TTA efforts, because our resources are limited, our staff time is limited. And so if you can figure out, A, what you're hearing from people, but B, where you're currently doing a lot of things, and maybe where your opportunities, where your strengths are, where you have a lot of training opportunities, or a lot of trainings going on, and then maybe some other things that you aren't training on. So we're hoping that this will help you really assess that. And so at the heart of what our self-assessment tool is, it's going to allow you guys to assess both your strengths and opportunities regarding your training efforts in these different categories. Now, these different categories are based on our core components of a high-functioning health center when it comes to workforce. And so some of these may look familiar to you, but we wanted to really ensure that we were aligning our training opportunity, our assessment with that in with that high functioning health center when it comes to workforce. So these might look familiar if you're familiar with that, and if not, great. We're excited that you're learning about it now. So these different categories, everything from leadership engagement, positive engaged culture, high functioning managers, they're going to get at your TTA efforts. Wanted to give you guys a taste of some of the questions, just a couple. So as far as, so in the leadership engagement section, one of the questions is, which health center staff does your organization target for workforce TTA? Everything, there are a ton of different options. So are you targeting chief executive officers, chief operations officers, chief financial officers, chief medical officers, chief workforce officers, human resources director, human resources staff, recruiter, or other? So really it just goes to show you that if you have, and this is a select all that applies, so you can see where you're targeting your training efforts. And if there is something that you end up checking it and you're like, gosh, we're missing, our chief medical officer. Well, maybe then you realize that you need to do some more CMO training, those kind of things. So that is for leadership engagement. There's another one I wanted to share with you guys as far as a sample question, and that is on a positive, focusing on a positive, engaged culture. So for this, a sample question would be, does your TTA program describe practical strategies to minimize staff burnout in the health center setting? Some of the sample answers would be yes, no, or unsure. So if your answer might be no to this, that might be something that you know that you might want to focus a training on in the future. So things like that, really just assessing all of the TTA that you're doing at your PCA and where you might need to focus on the future. Obviously, there could be things that you're just hearing about that you find out that that folks want training on, or that they, or that you just see gaps in there. You just see gaps in there. Okay, so stay tuned for that. That will come to your inbox probably on Monday of next week. So stay tuned for that, along with the slides and also the recording from the session. And we did have a question come in before I get to this next slide I wanted to address. So someone asked, will the in-person meeting be 1 day only or 2 days? It will most likely be a day and a half. We want to provide a good value for you guys to, to attend. And I didn't mention it in the previous slide, but I just wanted to mention that it will be a free training, and it will be something that you all will have to cover the cost of your travel and your meals, but the training will be absolutely free. It won't be like a conference where you have to, there's a fee associated with it. It will be at no charge to you guys. So the only charge would be your travel logistics. So again, stay tuned for more information, and we're really excited about that, and hope you guys will be excited about that as well. Okay, so as we wrap up today, our next session is going to be 1 month from today, 4 weeks from today, and it's going to be on February 20th, 2020. So it's going to be on 2/20/20. Anyway, a little number thing. Anyway, at 2 p.m. So, and this particular session is going to be aligning recruitment and retention strategies. So I mentioned a lot today that how recruitment and retention are linked, and this session is going to focus specifically on that, and how really having those best practices for recruitment can affect retention. And we're trying something different today. We are going to be putting a session evaluation up in our doing a poll. So Mariah is going to launch that. And so instead of doing something that is separate, we hope that you'll go ahead and fill this evaluation out now. And so we can get that feedback. Again, would love to hear any particular comments or feedback about what you would like, or how you felt about this training. And so while we're doing that, I will put our slide up here that has all of our contact information. Truly, we love talking to you guys. So if there's something that you need, or just want to know, or a resource that we talked about today that you want to know more about, we would love to chat with you guys about that. So let us know, and we would absolutely love to share that information with you. Looks like we're going to keep the poll open for about another minute or so, because since it's a little bit longer, I know that folks take some time to fill it out. So any other questions that you guys have, or anything you would like to share? I think everybody's on mute, so we're not able to do that. Okay, and as Mariah mentioned, we're not going to be sharing this. Sorry about that. My office mate decided to be a little loud. My four-legged office mate. So anyway, we're not going to be sharing the results of that poll, but that we are going to be just utilizing them on an internal basis. So we hope you'll fill that out and share what you thought about the session with us. So anyway, so we're going to leave that open for about another 15 seconds. And don't see any other questions that are coming in. Really appreciate the time that you are spending with us and hope you're finding value in this. We look forward to talking to you next time. And again, we will send out the slides, the evaluation, excuse me, not the evaluation, the slides, the recording, as well as look for that TTA self-assessment assignment. So thank you everyone for your time today, and really excited that everyone was with us. And we look forward to seeing you on February 20th for our next session. All right, everybody, take care.